Welcome to today's OECD Green Talks Live. Today's topic is going to be on mitigating the risks of pharmaceutical residues in the environment, which is quite a hot topic these days. We're all aware, and nobody's disputing the beneficial effects of pharmaceuticals on human life, on human health and animal health, food production and economic welfare in general. But one area where we lack maybe common understanding are the effects on the environment. Knowing that pharmaceuticals are constantly discharged and that quantities used and discharged are increasing through pharmaceutical manufacturing, consumption, and improper disposal of expired products. And this has been an area of work that countries have asked us to look into. And some of you may know the presence of pharmaceuticals in the environment has also been adopted as an emerging policy issue under the UN strategic approach to international chemicals management. And the OECD, the World Health Organization, and UN Environment Program have been tasked with assisting countries in addressing this issue. And so it's therefore my great pleasure to welcome Hannah Leckie here today. She's leading the OECD's work on water quality, and she will tell us all about her work on pharmaceutical residues in the environment, potential consequences of not addressing it, and what are policy solutions that countries can adopt to overcome the challenge. So Hannah will talk for about 20 minutes on this topic, drawing on the key messages of the report that we released just yesterday, called Pharmaceutical Residues in Freshwater, Hazards and Policy Responses. This report is a result of over 2 years of work, and in doing so we involved quite a number of stakeholders, from government officials, from environment sector, health and chemical sector. We involved pharmaceutical industry, water and wastewater utilities, of course NGOs and academia. After Hannah's presentation, there will be time for questions and answers. We'll have about half an hour. And for those of you joining us online today, I know you are quite numerous, you can send questions at any time during the talk to the questions moderator in the chat section of your WebEx screen. And Hannah and I will do our best to answer them. So without further ado, I'll hand over to Hannah for your presentation.
Thank you very much, Bob. Good evening, everybody, both to you here in the room and online. It's great to have you all here. So this talk conveys the key messages of this report that was launched just yesterday on pharmaceutical residues in freshwater, hazards and policy responses. And this work was triggered by an emerging and growing concern of water pollution and pharmaceuticals from our OECD member countries, and their demand for policy guidance on how to implement more economically efficient and environmentally effective policies to improve water quality. The report showcases a number of case studies submitted by country delegates and experts, and builds on discussions held at an OECD workshop last year and throughout the whole process, all of which I'm really grateful for. So this evening I want to go briefly through the main messages, covering the sources of pharmaceuticals and their pathways into the environment, why we should be concerned about pharmaceutical residues in their environment, current policy responses in OECD countries and demands on policy solutions, some of the barriers to taking action, and then finish up with some key policy recommendations and their cost effectiveness, particularly with regarding AMR or antimicrobial resistance, and some examples of what's been happening in OECD countries. So this diagram here, it illustrates the sources of pharmaceuticals and their environment, where they can end up in surface water and groundwater or in the soil. So the major sources of pollution include pharmaceutical manufacturers, households, hospitals and elderly care homes via wastewater treatment plants and inappropriate disposal of pharmaceuticals. And also the direct discharge of untreated wastewater can be a major source of pharmaceuticals in the environment, particularly in developing economies where wastewater collection and treatment facilities may not yet be established. And then there's also agriculture and aquaculture, which can involve the use of antibiotics and hormones as growth promoters and for the prevention of disease. So we estimate, or it's estimated, that 30 to 90% of the oral pharmaceuticals administered to humans and animals are excreted as active substances, which then find their way into our sewer systems or directly into the water cycle. So residues of pharmaceuticals have been detected in surface water and groundwater across the globe, as this map here shows. However, there's still a lot we don't know about the occurrence of pharmaceuticals in their environment, and the areas in grey in this map show where there's no data. And we know even less about the concentrations that we find of pharmaceuticals in the environment. Recent research by Professor Alistair Boxall of the University of York does show some concentrations of antibiotics in cities in Africa, Asia and South America in the 100 milligrams per litre range, which is really high and is a key concern for development of antimicrobial resistance. In OECD economies, the highest concentrations are found in areas with high population density and areas where there's low flow in rivers where wastewater discharge is then enters the environment. So the use of pharmaceuticals is increasing as we see populations age, increased lifespans, economic growth, particularly in emerging economies, and with it an increasing ability and expectation to treat aging-related and chronic diseases. We're seeing constant engineering of new pharmaceuticals, and we're also seeing clinical practices evolve, including recommendations for earlier treatment, higher dosages, or prolonged treatment. Intensification of livestock and agriculture practices will increase the need for more pharmaceuticals. And then climate change will exacerbate existing diseases and increase the need for pharmaceuticals. So this is a recent paper from Nature showing that anthropogenic climate change stresses native life, thereby enabling pathogens to increasingly cause disease. Human activities such as population growth and transport combined with climate change increases antibiotic resistance of pathogens and the spread of waterborne and vector-borne diseases, thereby increasing diseases in humans and other animals and plants, and therefore the need for greater use of pharmaceuticals. Climate change will also lead to an increase in the variability of rainfall and river flows, which will then affect the dilution potential of pharmaceutical residues that enter wastewater from wastewater discharge. So as a result of these factors, unless adequate measures are taken to manage the related risks, pharmaceuticals will increasingly be released into the environment. For example, this graph here shows Germany, which has forecasted that the total usage of prescription pharmaceuticals will increase by up to nearly 70% by 2045. And self-medication or over-the-counter purchases of medicines is estimated to grow even faster. All of these trends point to more pharmaceuticals in the environment unless action is taken. So a number of newspaper headlines reflect increasing detection of pharmaceuticals in their environment, increasing public awareness of the potential impacts and the expectations for improved drinking water quality and the protection of freshwater ecosystems. And I think the media do a pretty good job of reporting on the science. For example, recent headlines read, "Large numbers of pharmaceuticals in rivers at dangerous levels to wildlife and the environment. Pollution puts pharmaceutical supply chains under the spotlight. Why are these male fish growing eggs? Hormones and other pharmaceuticals can act as endocrine disruptors, which can cause the feminization of fish. Antidepressants are finding their way into fish brains and altering their behaviour. Cattle drug threatens thousands of vultures, and in this case this was diclofenac in India. World's rivers are washed with dangerous levels of antibiotics. This study that I mentioned by Professor Alistair Boxall finds the drugs of antibiotics in 2/3 of test sites in 72 countries. And pharmaceutical pollution is linked to the rise in superbugs. The World Health Organization warns that urgent action is needed to tackle the global misuse of antibiotics. And OECD figures show that antibiotic-resistant superbugs could kill 90,000 Britons by 2050 and could kill 1.3 million people in Europe by 2050 unless more is done to tackle the issue. The projected rise in resistance to second and third line antibiotics is particularly worrisome. And more documentation of laboratory testing on the effects of pharmaceutical residues on aquatic organisms and human health is documented in the report. So when we look at current policy approaches to water quality protection, we know that from experience in OECD countries, they're typically reactive. Measures are adopted only when routine monitoring is in place and risks can be proven. We have found that country responses to the pharmaceutical problem have often focused on monitoring, although the vast majority of pharmaceuticals remain unmonitored. And we're also seeing some end-of-pipe measures such as upgrading wastewater treatment plants. And Switzerland is an example where major wastewater treatment plants have been upgraded to remove pharmaceutical residues and other emerging pollutants. But there are two problems with these existing approaches. Firstly, the large number of pharmaceuticals and the constant engineering of new ones means that it is impractical, technically and economically, to undertake analytical monitoring and environmental risk assessment en masse for all active pharmaceutical ingredients in the environment. And there are about 2,000 pharmaceutical ingredients being used worldwide, and we only have comprehensive environmental toxicity data for about 10% of those. And secondly, wastewater treatment plant upgrades are limited by their removal efficiencies, high investment costs and their operation costs, and associated with that there are affordability issues. And then there's also increased energy consumption and a carbon footprint. They also do not remove diffuse or non-point source pollution of pharmaceuticals used in agriculture or aquaculture. So as part of this project, the OECD conducted a questionnaire on contaminants of emerging concern, including pharmaceuticals in freshwater. And a number of barriers to action were identified by governments, including the high costs involved and limited resources. There were knowledge-related barriers, such as insufficient evidence and an absence of a systematic approach to risk assessment. Legislative barriers, including a lack of frameworks to develop legislation, flexibility of legislation, and control over internet purchases. Also regulatory boundaries to apply the precautionary and the polluter pays principles. And finally, resistance from industry. So turning to the recommendations now, firstly, it's important to qualify that pharmaceuticals are really necessary for human and animal health, food production and economic welfare. We're really not trying to reduce access to pharmaceuticals. All of this being said, we recommend a lifecycle approach to addressing pharmaceuticals and their environment with action from all stakeholders from the design phase right through to disposal. And an efficient abatement strategy combines policy options at various stages of this pharmaceutical life cycle, involving stakeholders from government agencies, including environmental, public health policy and marketing authorization, pharmaceutical companies and manufacturers, distributors, physicians, veterinarians, pharmacists, hospitals, individual users, both patients and farmers, and then finally wastewater treatment utilities and solid waste utilities. Action on pharmaceuticals and the environment is much more likely to be extended and sustainable if it's mainstreamed into broader health, agriculture, and environment policy. So the life cycle approach means using a combination of 4 approaches. The first one is improvement in the knowledge, understanding, and reporting on the occurrence, toxicity, and impacts of pharmaceuticals in the environment in order to lay the ground for future policy action. For example, Korea uses suspect and non-target screening to identify and prioritize pharmaceuticals for water quality monitoring. The transparency of data and of environmental risk assessments of pharmaceutical ingredients should also be improved to reduce duplication of costly testing efforts. The relative risk of pharmaceuticals in the environment needs to be compared with other more traditional pollutants such as heavy metals and persistent organic pollutants and pathogens to direct limited resources to achieve improvements in water quality and ecosystems in the most cost-effective way. The second approach is source-directed policies to prevent the release of pharmaceuticals into water bodies. This may include incentives for the design of green pharmacy or biodegradable pharmaceuticals or personalised medicines. It may include incorporation of environmental risks into pharmaceutical authorisation so that the risks can be better mitigated, and green public procurement with environmental criteria to limit pollution. It also means prioritising substances and water bodies of highest concern and targeting areas of high pollution. This may include regulations as part of good manufacturing practices for pharmaceutical manufacturing plants as part of their industry audits or wastewater discharge permits. The third approach is use-orientated policies to reduce inappropriate or excessive use of pharmaceuticals. For example, Germany has developed an environmental checklist for veterinarians and farmers with the aim of reducing the use and the release of veterinary pharmaceuticals into the environment. Improved health, well-being and hygiene practices and improved diagnostics can reduce the unnecessary use of pharmaceuticals. And then the final approach is end-of-pipe measures such as improved waste and wastewater collection and treatment to remove pharmaceutical residues after their use. For example, Australia has a national pharmaceutical collection and disposal program with retail pharmacies commonly acting as collection sites to avoid improper disposal of used and expired medications. We recommend, emission reduction through wastewater treatment plant upgrades. They are costly and they should be a complementary measure to source and use-orientated measures. We can also be smart about where we choose to upgrade wastewater treatment plants based on the size of the population served, the sensitivity of the receiving environment, and the flows in the receiving environment. A focus on preventative source-directed and use-orientated options early in the pharmaceutical life cycle may deliver the most long-term, cost-effective and large-scale benefits. Looking at some other emerging innovative responses in addition to the ones I just mentioned, in the United Kingdom, the poultry industry has successfully reduced unnecessary antibiotic use whilst increasing meat production, and that was with a voluntary antibiotic stewardship program. Sweden has a WISE list of recommended pharmaceuticals for the treatment of common diseases, and this is for doctors, and it takes into account the environmental impact when comparing medications that are equally safe and equally suitable for their medical purposes. The NHS in Scotland has replaced diclofenac with naproxen as the preferred prescription choice for anti-inflammatory, as an anti-inflammatory for environmental reasons. The Swedish government, they've just introduced a revised public procurement system in which environmental criteria are considered when pharmaceutical companies compete to obtain product subsidies for state healthcare. Norway, the Netherlands and Denmark are all also considering sustainable procurement criteria for their pharmaceuticals. The United States, they have national regulations on the disposal of hazardous pharmaceutical waste in the health sector. And then I mentioned earlier, Switzerland, they've upgraded a number of their wastewater treatment plants, and to do that, they have a nationwide tax to fund these upgrades with new technologies. France, Germany and the Netherlands, Sweden and the United Kingdom have all started multi-sector dialogues to tackle the problem. And at the EU level, we've seen a strategic approach to pharmaceuticals and their environment, which is a new strategy that identifies actions for stakeholders throughout the pharmaceutical life cycle with an emphasis on sharing good practices, on cooperating at the international level, and on improving the understanding of risks. So antimicrobial resistance, as I've mentioned, is beginning a lot of attention, and so I thought I would quickly go through some of the main messages of work done by another directorate and the health department that stems from a report called Stemming the Superbug Tide, released in 2018. And they show that policy approaches to tackle antimicrobial resistance saves lives. For example, their modelling shows improved hand hygiene, stewardship programs such as educational and behavioural interventions for physicians and decision aid tools, and enhanced environmental hygiene and advanced cleaning techniques in hospitals could avoid 20,000 deaths from antimicrobial resistance each year in the EU and the European Economic Area alone. And public health interventions to tackle antimicrobial resistance are a cost-effective and often very cost-saving investment in OECD and EU countries. This chart here shows that improved hand hygiene, stewardship programs and delayed prescriptions are all usually cost-saving. And environmental hygiene, rapid diagnostic testing are often cost-saving, but there can be large differences across countries. And combining these interventions in a four-pronged public health package provides the best results to stem the superbug tide, with saving up to 47,000 lives per year in OECD and EU countries alone. And decreasing healthcare expenditure by an average of $3 per capita per year and up to $10 per capita per year in Malta. So that's it from me for now. Keen to hear any questions you have. Thank you.
All right. Thank you, Hannah, for presenting your super report and the policy options that countries can implement to address the issue. As a moderator, I have the privilege, I should have some privileges, so let me ask you a first question. How do you think the problem of pharmaceutical residues in water compares to other water quality issues?
Well, it's a very context-specific question. We recommend that an assessment be done when countries look to use limited financial resources to tackling or improving water quality. So it'll be dependent on things like the population density, the land use in a river basin, whether there's intensive agriculture, whether there's pharmaceutical manufacturing happening. For countries that have already achieved universal access to water supply and sanitation, pharmaceuticals may be higher on their priority list for improving water quality. For developing economies, the collection and treatment of wastewater to remove pathogens that cause water-related diseases may be more of a priority, so tackling the pathogens rather than pharmaceutical pollution.
Okay, thanks. For those of you online, please don't forget to send your questions to Questions Moderator in the chat section of your WebEx screen. I'll look around in the room and ask if there are any questions from people here. There has to be some advantage to showing up. Please.
Thank you very much, and very interesting report, Hannah. Thank you for the very clear overview. I'm curious, you talked a lot about OECD countries and advanced economies. Does the report also cover developing countries, and Are some of the policy recommendations the same for developed and developing countries, or do they need to be adapted or adjusted for developing country contexts?
Thanks for the question. So the report primarily looks at OECD countries, but there is a lot of recommendations that will equally apply to developing economies. The priorities will be a little bit different. So I mentioned about getting universal access to water supply and sanitation and the importance of that for human health, but also for economic growth. There's a lot that can be done on education, promoting that the use of pharmaceuticals is not a substitute for good hygiene. So having good hygiene practices in hospitals and schools at the household level is important for prevention of disease and therefore the need for antibiotics. There's also perhaps that's not so much mentioned in the report in terms of the OECD context, but there can be issues in developing economies with a lot of illegal sales and a lack of control over pharmaceuticals and over-the-counter purchases. And also emerging economies may not have the same environmental standards and enforcement and regulation that OECD countries will have when it comes to manufacturing. So there are some of the things that emerging economies could look at. Another one is improved solid waste management, so that we're not getting these pharmaceuticals going uncontrolled into landfills that then leach down into groundwater or wash off into rivers. I would say, again, just to emphasise the importance of wastewater collection and treatment. So if you get a combination of untreated wastewater effluent entering rivers, which results in an increased exposure to pathogens and water-related diseases, and when that's mixed with high concentrations of antibiotics, it's a really dangerous combination for selection of antimicrobial resistance. So they would be my thoughts on developing countries.
Okay, thank you. Matthew?
Yeah, thanks ever so much, Hannah. Really interesting. I was interested in the Swiss example that you presented, and they looked to have taken the approach to upgrade wastewater treatment facilities. And I wondered, is there any data coming out of that yet in terms of how much more cost does it add and how effective is it? Are they getting the results they hoped for? And have they taken a kind of a broad brush approach, or are they prioritising catchments and particular plants, as you've suggested, as an approach?
Yeah, good question. So I can't recall all of the figures off the top of my head, but so Switzerland have introduced a nationwide tax to help fund the upgrade of 100 wastewater treatment plants, and they've prioritised major wastewater treatment plants that are serving a large population. So yeah, they have thought about which ones to upgrade. In terms of affordability and willingness to pay, Switzerland did do a survey before they went down this policy route with different stakeholders, and there was an overwhelming response that the citizens of Switzerland were willing to pay for wastewater treatment plant upgrades, even if the wastewater treatment plant wasn't in their district. So I think that gives some awareness to the problem in the public domain in Switzerland. But yeah, it's something we wouldn't advocate as a response alone. So Switzerland, they have put in place other measures to reduce pharmaceuticals in the environment through source-directed and use-orientated measures, and that's something that we would recommend before countries consider wastewater treatment plant upgrades, because they're costly and there's other trade-offs as well.
Okay, thank you very much. Let's take one or two questions that we've received online. Hannah, what do you think is the most important thing that the pharmaceutical industry can do to help solve the issue?
So we've engaged with the pharmaceutical industry throughout this project. They were involved in the workshop that we held last year. our main purpose is to serve our OECD member country governments. So that's been the priority in terms of the recommendations here, but industry have been consulted throughout the process. There's a lot industry can do, and that some pharmaceutical companies are already doing voluntarily. So for instance, when it comes to pharmaceutical manufacturing, there are no regulations requiring treatment of effluent to levels below which there'd be no known effects on ecosystems. But some pharmaceutical companies are choosing to take action voluntarily to treat their wastewater coming out of manufacturing plants. There is also a role for the pharmaceutical industry to play in the design of green pharmacy or green pharmaceuticals that are more biodegradable. And we're seeing a pretty slow response in terms of that domain, and that's where I think the pharmaceutical industry and governments could work better together in developing incentives and new business models to help incentivize the development of green pharmaceuticals and of new antibiotics which are needed to tackle the antimicrobial resistance crisis.
All right, thank you very much. Another question from the room, Amy?
Yeah, I can understand that in the life cycle process, you'd want to keep as few pharmaceuticals moving into the water, into the trash bins, etc. Going up from that is how they're packaged. In some countries, they're packaged in boxes of 12, and your doctor prescribes 8. So you have automatically 4 that are going to drop somewhere. And do you know how many OECD countries actually individualize their distribution of pharmaceuticals? And also, how many countries actually have a campaign or a way in which the public can move their pharmaceuticals into the hands of people who know how to avoid having them going into the environment? And does that really make a difference?
So in the report we talk about having the right drug, the right dose at the right time, and improved diagnostics is one key element that can help in that process, so that we're not, for instance, giving antibiotics for a virus. And the doctors and the pharmacists play a critical role in helping inform and educate patients to, for instance, finish their line of antibiotics and not to finish them early even if they're feeling better. In terms of individualizing pharmaceuticals, we're seeing a lot of personalized medicines being developed by pharmaceutical companies. We haven't documented which countries have personalized medicines as part of their public health care. But I know, for instance, in my home country in New Zealand, I will be giving the exact number of pills I need per month for my personal medications, and it's something that I don't personally see here in France. And then in OECD countries, there's also certified pharmacists, which, by having certified pharmacists and regulations around which pharmaceuticals are able to be purchased over the counter, helps regulate the problem as well. And what we're seeing in Sweden is that they've introduced eco-labelling schemes in some of their pharmacies, which enables consumers to make an informed choice around which anti-inflammatory to take if they want to avoid harmful effects on the environment.
Okay, thank you. I'll take another question here from people participating via WebEx. One question we're receiving is it not more relevant, instead of having a broad end-of-pipe policy and upgrading all wastewater treatment plants, and would it not make more sense to focus on hotspot sources such as hospitals or healthcare centers before going all the way and upgrading all wastewater treatment plants.
Yes, a good question. We're not advocating for all wastewater treatment plants to be upgraded. Just to emphasise, the life cycle approach and action upstream can give more cost-effective responses. In terms of upgrading wastewater treatment plants and hotspots, we have looked at research that's been done by different countries as to whether it's economical and cost-effective to upgrade or to have decentralised wastewater treatment at hospitals, for instance, which can be a hotspot for pharmaceuticals. But the research shows that over 95% of the pharmaceuticals that are taken at the household level. They're not taken in hospitals. Even if you're prescribed at the hospital, you'll most often take them home and then excrete them when you're at home. So most of the research shows that it's not a good approach to have decentralised wastewater treatment at hospitals, especially given how costly it is. You would first have to establish primary and secondary and tertiary treatment at the hospital level and then add another level of treatment to remove pharmaceuticals. So, the best option is to upgrade in these large cities that serve a large population, and particularly in areas where there's a sensitive ecosystem or where there's low flow in rivers and therefore a low dilution potential for pollution. Also, just to say that upgrading wastewater treatment plants with this extra level of treatment can, of course, remove other pollutants other than just pharmaceuticals. So there you have some co-benefits in terms of removing other pollutants that aren't traditionally removed from secondary or tertiary treatment.
Okay, thank you very much. I'll have one more question from the room. Leon?
Thank you, Hannah. It was a very interesting talk. Thank you very much. You've mentioned examples from governments, and we talked about industry action that they could do. We just briefly also hinted at the public, and they are, of course, also a very major player in the life cycle. Did you investigate any specific action that the public, the household, can do as well in your report?
Thanks, Leon. Yes, so some of these I already mentioned. Appropriate disposal for a start, so don't flush your pharmaceuticals down the toilet or put them down the sink. The best practice is to return them to your pharmacist, who will dispose of them properly, and usually that's by incineration. Finish your prescriptions. Even if you are feeling better, you should finish them right through to the end, and then that reduce the risks of a relapse and then the need for a prescription or prescribing more pharmaceuticals. Improve diagnostics, talk to your doctor, talk to your pharmacist about the right dose, the right drug at the right time. We talked about eco-labelling as well. That's something that consumers can make an informed choice of if that's available in their country. Sweden's one example there. And then, of course, to practice good hygiene to prevent the need for pharmaceuticals and being sick in the first place. So wash your hands, practice good hygiene, be healthy diet, good sleep, reduce stress, all of those things for improved health and less need for pharmaceuticals.
You mentioned taking your unused drugs to the local pharmacists. Do we know if all countries have take-back schemes and how well they are known? For those of us who live in France, I think most people don't know that there is a take-back scheme. If they hadn't advertised for it over the last few months, I don't think anybody would know. So do we know how it is in other countries?
Yeah, I don't believe there is a nationwide take-back scheme here in France. I return my medications to my pharmacist anyway. But in a lot of other OECD countries, there are take-back schemes. Australia is one example, the US is another, Sweden, a bunch of the Nordic countries do the same. And it is documented in the report if anyone wants to look in more detail. And also just to say, I'm glad you raised it, Bob, is that this work on pharmaceutical waste will be continuing in the next year and a half with the circular economy team. So it's one issue that we recognise as a problem, and that our OECD countries would like to deep dive more into. So watch this space, there'll be more work coming out.
Okay, thank you. One question we are getting over the web is what is the role of green design, and do you see any prospects of an increased role of green design, and do you think it will be successful?
Well, there's kind of mixed views on the role of green pharmacy. First of all, we really need a good definition of green pharmacy and an agreed one. There's a number of barriers to green pharmacy that are discussed in the report and potential ways to overcome them. It's often viewed as a utopia, green pharmacy, but we have seen demonstrated new pharmaceuticals developed that show that stability does not exclude biodegradability. That also shows that biodegradability can be included intentionally in the design of pharmaceuticals, and that biodegradability can improve the therapeutic effect and reduce side effects in humans. So, the government needs to play a role in incentivising green pharmacy so that this space can really take off, and there's a number of recommendations that we have in the report to help incentivise green pharmacy. So I think it is something that governments should be considering.
All right, thank you. Other questions in the room? Not just now. So one other question received from our participants on the web is you mentioned the sustainable procurement criteria used in Sweden. How upscalable do you think are these? Is there a role for the OECD to develop sustainable procurement criteria that countries could use and implement?
Yeah, so Sweden has introduced some sustainable procurement criteria. They're only published in English a few weeks ago, and I only found out about them on Tuesday. But I can, if the person online wants to follow up with me by email, I can share more about that. So Sweden's gone ahead. This is something that's in policy now, and we're seeing a number of other countries in the EU that are looking to also develop environmental criteria for public procurement. And it's one recommendation that I've received pretty much universal agreement on from all stakeholders. So I think it is a key recommendation that governments should be thinking of. It perhaps would be nice if the European Union considered developing sustainable procurement criteria at the EU level. As far as the OECD role in developing sustainable criteria, it's probably not our role. We'll see in the next program of work whether there's demand from it from our OECD member countries, but not at this stage.
Okay, thank you. The OECD is a champion of development and implementation of extended producer responsibility. Is there a role for this scheme also for pharmaceuticals?
So extended producer responsibility, we just do discuss that a little bit in the report. There is a potential role for extended producer responsibility in take-back schemes, public take-back schemes of unused or expired medications. So that's one role that the costs of such a scheme can be extended to the producer or the pharmaceutical companies. And that will be discussed even in more detail in our forthcoming work on the role of the circular economy and pharmaceutical take-back schemes. In terms of other roles of EPR, perhaps there's a potential for extended producer responsibility to cover some of the costs of wastewater treatment plant upgrades. particularly where there's pharmaceutical manufacturing plants operating in a river basin, and that wastewater then goes to a receiving wastewater treatment plant, and there's additional costs imposed there. So there could be a role there. I know Germany is exploring the potential for that. It's not documented in the report yet because it's early stages, but I'm also happy to follow up with whoever asked that question if they want to email me.
Okay, thank you very much. We do get some provocative questions over the internet, which is fine. One is saying that we're recommending that the environmental risk assessment is being used in the authorization process for pharmaceuticals, and the question is what do we expect from, what do we hope to get out of that?
So when I talk about having environmental risk assessments and the inclusion of them in the risk-benefit analysis for the authorization of new pharmaceuticals, I'm not talking about pharmaceuticals not being approved because of their environmental risks. I think everyone can agree that new pharmaceuticals that can have a good impact on human health is takes priority. But in looking at the risks, we can then impose some mitigation measures to mitigate those risks. Perhaps it might mean there's more environmental monitoring. It might mean that there's more stringent conditions on treatment of wastewater from manufacturing plants. It might mean there's eco-labelling on the package or restrictions on over-the-counter purchases. There can be a range of these policy recommendations that I've mentioned could be applied to pharmaceuticals that are approved that have high environmental risks. In terms of environmental risk assessments, just to let you know, so new pharmaceuticals are required to have an environmental risk assessment now, but there's a problem with all of the legacy pharmaceuticals, so the majority of pharmaceuticals on the market now that were introduced before this new legislation required environmental risk assessments. So there's the problem of how do we get data sets for these legacy pharmaceuticals, and there needs to be some pretty hard discussions around how to fill that data gap, and then establishing a shared database so that we don't have duplication of testing, which is very costly in different countries.
Okay, thank you. Any other questions in the room? Oh.
Thank you, Hannah, for a very timely, I think, report and a well-balanced one. You insisted in the beginning of your presentation that we don't want to prevent access or make access to drugs more difficult for patients. I'd like to a little bit challenge you on that. Where do you see potential tensions between this principle, which I think we fully endorse, and some of the policy recommendations that derive from the report?
Well, it's true that I did say that, but there will be some cases where high-risk pharmaceuticals should be restricted so that they're used in an appropriate way. For instance, the overuse of antibiotics in agriculture and aquaculture, which are often used as a preventative measure or as a substitute for good hygiene practices, such as the management of livestock in stables or the management of manure. So in terms of restricting pharmaceuticals there, I would say that there is a role that governments should play in terms of reducing antimicrobial resistance and reducing the inappropriate or the excessive use of pharmaceuticals that have high environmental impact.
All right, thank you very much. There's one or several questions from web participants about eco-labeling. Do you see any role for eco-labeling in pharmaceuticals? Coming from the chemical side myself, So I could imagine that we could extend globally harmonized system to classification and labeling of chemicals also to pharmaceuticals, at least the environmental hazard bits. Do you know if there's any countries that do have eco-labeling schemes for pharmaceuticals, and what might be the prospects of those?
So we're seeing eco-labeling happening now already in Sweden at some of the pharmacies, and then that can inform consumers when they go to purchase over-the-counter pharmaceuticals in pharmacies. In terms of eco-labeling as a recommendation, it's not been very popular with some of the pharmaceutical industry. What we have seen is there is some instructions for appropriate disposal of pharmaceuticals in other countries, but they'll be in the instructions, the long instructions inside the box of medications, and often most people won't read those. So there could be a role for eco-labeling given that the instructions are already embedded in the box in a lot of countries, to have them on the outside of the box. So that not only for consumer choice, but also just to raise awareness to consumers that they need to dispose of their pharmaceuticals properly. Again, pharmacists and doctors can play a role there too, around encouraging patients to return their unused or expired pharmaceuticals.
Amy, please.
Yeah, thank you, Hannah. That was actually quite an interesting idea. I have a question regarding doctors and how much eco-labeling may be at the stage of showing medicines to doctors, because frequently doctors have 2 or 3 antibiotics they can use from different pharmacies, and getting them to understand that, okay, if you prescribe this one or that one, it may be the same for your patient, but it may not be the same for environment. Is there any thought to kind of moving that out into the world of the doctor-pharmaceutical connection versus to the patient per se?
Yes, so we're already seeing that happen again in Sweden. So they have what they call a WISE list, and it's a list for doctors that has not only the costs and the cost effectiveness and the role for different drugs for different illnesses, but it also has their environmental impacts. And so doctors can make informed choices around which pharmaceuticals will have the same, give the same purpose to the patient, but come at a lower impact to the environment. So we're already seeing that happen in Sweden. A number of other countries are considering it. I mentioned the NHS in Scotland. They've already encouraging doctors to prescribe naproxen instead of diclofenac as an anti-inflammatory for environmental reasons. So I think it's a space that countries are really looking at filling for the role of doctors.
Okay, well, thank you very much. Thank you very much, everybody, for participating. Thank you much, everybody on the web, for participating and providing interesting questions and challenging questions to Hannah. I think we can all agree that the topic of pharmaceutical residues in freshwater is not an issue that has simple solutions. It is an issue that needs a holistic approach. It is an issue that needs a life cycle approach. It's an issue that needs a combination of policy solutions. And so it's something that countries will need to implement with quite a number of stakeholders. So thank you again, and before we sign out, I would like to announce the next OECD Green Talk Live, where we will discuss scaling up climate-compatible infrastructure, and we will have insights from national development banks in Brazil and South Africa. And this Green Talk will happen next week, Friday, on the 22nd of November. Registrations are already open, and you see the link here where you can find information on the talk and how to register. So with that, thanks again, everybody, and happy Thursday to everybody who participated. Thank you.